Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a general practitioner talking to a patient named Mrs. Ahmed. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Ahmed, come in, please. Have a seat.
Thank you, Doctor.
What brings you in today?
Well, I recently had a routine blood test done as part of a general checkup, and the results came back saying I tested positive for hepatitis B. Honestly, I'm a bit shocked because I don't feel sick or anything, but now I'm worried about what this means for me and my family.
I understand how concerning this might be for you, Mrs. Ahmed. Let me explain what this result means and what steps we can take. First, testing positive for hepatitis B means you've been exposed to the hepatitis B virus, which affects the liver. However, testing positive doesn't always mean you have an active infection. There are different phases of the condition. Have you noticed any symptoms like fatigue, abdominal pain, yellowing of the skin or eyes, or dark urine?
No, none of that. I feel completely normal.
That's good to hear. Many people with hepatitis B don't experience any symptoms, especially in the early stages. We'll need to do some follow-up blood tests to determine whether you have an acute infection, which means a recent exposure, or a chronic infection, which could mean you've carried the virus for longer.
Chronic? Does that mean it won't go away?
In some cases, yes. Chronic hepatitis B means the virus stays in your body long-term. However, it doesn't always cause serious problems. Many people with chronic hepatitis B live healthy lives without significant liver damage, but it's important to monitor it closely.
What causes it to become chronic?
It often depends on when the infection was acquired. People infected as adults are more likely to clear the virus on their own. However, when someone is infected as a child, the chances of it becoming chronic are much higher. Do you know if you've ever been vaccinated for hepatitis B?
I don't think so. I grew up overseas, and I don't remember getting a vaccine for it.
That might explain it. Hepatitis B is most commonly transmitted through blood or bodily fluids, such as during childbirth, unprotected sexual contact, or sharing needles. It's also possible to acquire it through certain medical procedures if proper precautions weren't followed.
So, what do I do now?
The first step is to determine whether this is an acute or chronic infection. We'll do a liver function test and a specific viral load test to measure how active the virus is. If it's a chronic infection, we'll regularly monitor your liver health with blood tests and possibly imaging like an ultrasound.
Will I need treatment?
Not everyone with chronic hepatitis B needs treatment. If the virus is inactive or your liver isn't being damaged, we'll simply monitor it. However, if the virus is active and causing damage, antiviral medications can help reduce the viral load and prevent complications like liver damage or cirrhosis.
Is it contagious? I'm worried about my family.
Hepatitis B can be transmitted, but there are ways to protect your family. First, they should all get tested to see if they've been exposed. If they haven't, vaccination can protect them. The vaccine is very effective and safe. If you have a partner, It's also a good idea to use barrier protection like condoms to prevent transmission.
I see. So, vaccination can really help?
Absolutely. The vaccine is highly protective, and it's part of the routine vaccination schedule for children in many countries now. In your case, it's also important to avoid sharing items like razors, toothbrushes, or anything that could come into contact with blood.
That makes sense. What about my diet or lifestyle? Should I change anything?
Maintaining a healthy lifestyle is very important. You should avoid alcohol as it can strain your liver further. A balanced diet, regular exercise, and avoiding unnecessary medications or supplements that could harm the liver are also key.
I'll make sure to follow that. I think I feel a little more at ease now that I understand it better.
I'm glad to hear that. Remember, you're not alone in this. We'll work together to monitor your health and keep everything under control. If you have any more questions or concerns, don't hesitate to reach out.
Thank you, Doctor. I really appreciate your help.
You're welcome. Let's take things step by step. I'll arrange the additional tests and we'll go from there.
Extract 2, questions 13 to 24. You hear an ENT specialist talking to a patient named Miss Gomez. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Gomez. Please come in. So, you've been referred to me by your GP for recurring sinus issues. Is that right?
Yes, that's right.
Okay. I've read through the referral, but I'd like to hear about it directly from you. How long have you been experiencing these problems, and how have they been affecting you?
Well, it started about 4 months ago. At first I thought it was just a stubborn cold because I was so congested and had constant pressure in my face. But after the third time the symptoms came back, I started to realize it wasn't going away. Now, it feels like I barely get a break before it flares up again.
That sounds frustrating. Could you describe your symptoms in a bit more detail? For instance, do you have facial pain, headaches, or any nasal discharge?
Yes, definitely all of those. The pain is mostly around my cheeks and forehead, and sometimes it even spreads to my upper teeth. My nose is constantly stuffy, and when I do manage to blow it, there's often thick yellowish mucus. I also feel really tired all the time, which I'm guessing is because I can't sleep properly.
Have you experienced any fever or changes in your sense of smell or taste?
Oh, I'm glad you mentioned that. My sense of smell is practically gone, and as for taste, everything seems dull. I haven't had a fever, though.
Got it. Now, when these symptoms occur, how long do they typically last?
Well, the first episode was about a week, but each one since then has lasted longer, sometimes 2 or even 3 weeks. And it seems like there's always some lingering congestion even when the worst of it passes.
I see. Your GP mentioned that you've been on some treatments already. Could you tell me what you've tried so far?
Sure. I've been prescribed antibiotics twice, and they seemed to help a bit, but the relief was short-lived. I also use a saline spray daily and tried a decongestant, but it only works temporarily. My GP suggested a steroid nasal spray, but I haven't started that yet.
Thanks for sharing that. Let's talk about your overall health. Do you have any other medical conditions or allergies I should know about?
Well, I have mild asthma, but it's well controlled. I don't have any allergies that I know of.
And what about your lifestyle? Do you smoke, or are you exposed to anything that might irritate your sinuses, like dust or chemicals?
I've never smoked, and I'm not around anything like that. Although my office is pretty dry because of the air conditioning.
That's worth noting. Dry environments can sometimes exacerbate sinus issues. Lastly, has this affected your day-to-day life in any significant way?
Oh, absolutely. I've missed several days of work because I feel so drained and miserable. I also find it hard to focus because of the pressure in my head. Even social events are tough because I'm always congested and sniffling, which is embarrassing.
I can see how this has been quite disruptive for you. Based on what you've described, it sounds like you may be dealing with chronic rhinosinusitis. This is when sinus inflammation lasts for more than 12 weeks and often comes with recurring acute episodes.
That makes sense. So, what can we do about it?
First, I'd like to confirm the diagnosis. We may need a CT scan of your sinuses to get a clearer picture of what's going on. In the meantime, starting the steroid nasal spray could reduce inflammation. I'd also recommend regular steam inhalation to help with congestion and perhaps a humidifier for your home or office.
Okay, I can do that.
Depending on the scan results, we may consider other options, such as a longer course of antibiotics, antihistamines if we suspect allergies, or even a minor surgical procedure like balloon sinuplasty to improve sinus drainage. But let's take it one step at a time.
That sounds like a plan. Thank you.
You're welcome, Gomez. Let's schedule a follow-up to review the scan results and discuss the next steps. Don't hesitate to reach out if your symptoms worsen in the meantime.
I will. Thanks again.
Take care.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 radiologists discussing the screening method for a high-risk lung cancer patient. Now, read the question.
I've just reviewed a case of a 65-year-old male with a 40-pack year smoking history. He's considered high risk for lung cancer, and the clinic is asking whether we should recommend a low-dose CT scan or a traditional chest X-ray for screening.
What are your thoughts on that?
I'm inclined to recommend the low-dose CT scan because it has a higher sensitivity for detecting early-stage lung cancer.
Is there any downside to using low-dose CT over a chest X-ray?
There's a slightly higher chance of false positives, but the benefits of early detection outweigh that. Plus, the radiation dose with low-dose CT is still minimal compared to traditional CT scans.
I see. So the low-dose CT balances accuracy with acceptable risks?
Exactly. If we detect an abnormality, follow-up imaging or biopsy can confirm the diagnosis.
Okay, that seems reasonable. Let's go with the low-dose CT for this patient and notify the clinic.
Now look at question 26. You hear a researcher speaking to a colleague about their efforts in translational research. Now, read the question.
We're in the process of refining the drug formulation to ensure safety for clinical trials.
I see. Did you encounter any challenges while adapting it for humans?
Definitely. The dosage range is tricky. Animals and humans metabolize it differently, so we're adjusting based on toxicity data from preclinical studies.
And once that's ready, you will apply for human trials?
Exactly. The regulatory approvals are already underway. If all goes well, we'll be able to move to phase 1 trials in a few months.
Exciting. Translating preclinical success to patients is always the most rewarding part.
Absolutely. This work could be a game changer for so many.
Now look at question 27. You hear a doctor briefing a colleague about a patient before their next appointment. Now read the question.
Okay, so the next thing is about Mr. Jameson in consultation room 2.
Right?
He's here today to follow up on his diabetes management. His last HbA1c was 9%, which is still above target. I've had multiple conversations with him about improving his diet and exercise routine, but he seems reluctant to make meaningful changes. I've explained that he may need to start on insulin if things don't improve. For now, I've adjusted his metformin dose to 1,000 milligrams twice daily and added sitagliptin once daily. He also needs a repeat HbA1c test in 3 months to assess progress. The priority today is to emphasize how important it is for him to commit to lifestyle changes and take his medication as prescribed. Can you focus on addressing his concerns and motivating him to stick to the plan?
Got it.
Now look at question 28. You hear a physiotherapist discussing with a patient. Now read the question. So today, we are going to discuss your recovery process after the hip replacement surgery and work out a plan to help you regain strength and independence. How have you been managing so far?
It's been challenging. I've started walking short distances with a walker, but it feels exhausting. I want to feel stronger so I can move around more freely at home.
What are the main challenges you're experiencing right now?
The biggest issue is getting out of bed in the mornings. It takes so much effort, and I feel weak and unsteady. I'm also nervous about trying to sit down and stand up from a chair without assistance. It's frustrating not being able to do these things independently.
Now look at question 29. You hear a medical professional explaining about antibiotics prescription. Now read the question.
Due to a significant increase in cases where antibiotics are being prescribed unnecessarily or inappropriately, we wanted to revisit our antibiotic stewardship program. I know some of you have recently completed training on this, but it is always valuable to reinforce key principles. The first step is to ensure that antibiotics are prescribed only when clinically indicated based on evidence and guidelines. This includes avoiding antibiotics for viral infections and ensuring cultures and sensitivities are checked before initiating therapy. Next, we must monitor the appropriate duration of therapy. Overuse or prolonged use of antibiotics can lead to resistance and other adverse effects. Please review our hospital's antibiotic usage protocols after this meeting to familiarize yourself with the recommended durations. Additionally, remember the importance of collaboration with our pharmacy team and infectious disease specialists. They are invaluable in guiding the most effective and targeted antibiotic use for our patients. Finally, we must educate patients about the risks of antibiotic misuse and the importance of completing prescribed courses. These efforts collectively support patient safety and reduce the threat of antibiotic resistance. Are there any questions?
Now look at question 30. You hear part of a surgical team's briefing. Now read the question.
Cardiac bypass surgery. Are there any specific concerns from an anesthesia standpoint?
His cardiovascular health is stable, but he has a history of controlled hypertension. No other major issues aside from a slightly elevated BMI of 32.
Do we need to consider additional monitoring for hypertension during the procedure?
Standard monitoring should suffice. We'll adjust as needed if his blood pressure fluctuates.
And for his postoperative pain management, what's the plan?
He's on a low dose of beta blockers, so we'll need to avoid medications that may cause significant drops in blood pressure. A nerve block might help with pain control without impacting his hemodynamics.
That sounds reasonable. We'll also ensure he has clear instructions about medication resumption post-surgery.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a GP talking about the increasing role of nutritional counseling in primary care settings. You now have 90 seconds to read questions.
Hello everyone, my name is Dr. Hannah Lewis, and I'm a general practitioner based in Devon. Today, I want to talk about the increasing role of nutritional counseling in primary care, and how it's transforming the way we manage and prevent conditions such as obesity, diabetes, and hypertension. Over the past decade, the healthcare landscape has changed dramatically. Non-communicable diseases, such as those I just mentioned, now account for a large portion of our workload as GPS. This shift has prompted us to take a closer look at preventative measures, and one key area that stands out is diet. Research shows that diet is a contributing factor to at least 30% of the cases of heart disease and diabetes we treat. Traditional medical interventions often address the symptoms but don't always tackle the root causes. Let me share a scenario that highlights this. I recently had a patient in her late 40s who was struggling with her weight and had just been diagnosed with type 2 diabetes. Like many others, she was overwhelmed by the prospect of managing her condition. Instead of focusing solely on prescribing medication, I referred her to our in-house dietitian. Over a series of sessions, she not only gained insights into her dietary habits but also learned practical ways to adjust them. Within 3 months, she noticed significant improvements in her blood sugar levels and overall energy. At our practice, we've started integrating nutritional counseling into our routine care. This can involve anything from brief dietary advice during a standard appointment to more comprehensive consultations with a dietitian. These sessions provide patients with a better understanding of how their food choices impact their health and offer personalized strategies for improvement. This approach has been particularly effective for patients managing long-term conditions like hypertension. Many patients have reported feeling more in control of their health after attending these consultations. Now, some might wonder, why can't GPS just handle this themselves? While we GPS do receive basic training in nutrition, the reality is that it's not sufficient to address the complexity of some cases. Dietitians, on the other hand, are experts in this field and can dedicate the time and expertise needed to work closely with patients. Additionally, many practices are also making use of group sessions, similar to the ones used in other areas of care, to provide nutritional guidance. These group settings not only save time but also allow patients to share experiences and learn from one another. Of course, there are challenges. Some patients are hesitant to change their habits or believe that dietary counseling won't make a significant difference. Others worry about the cost of accessing dietitian services, To address these barriers, many practices, including ours, offer free or subsidized consultations as part of routine care. We also emphasize the long-term benefits, showing patients how dietary changes can lead to fewer medications and better overall quality of life. In conclusion, nutritional counseling represents a powerful tool in managing and preventing chronic illnesses. By equipping patients with knowledge and support, we can help them take an active role in their health and move towards a future where food is truly viewed as medicine.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Lizzie Evans discussing about homeopathy. Now, read the questions. You now have 90 seconds to read questions.
Welcome to Health Insights, your go-to program for unraveling the latest health debates. Joining us today is Dr. Lizzie Evans, a consultant in integrative medicine at St. John's Health Institute. Thank you for being here, Dr. Evans. How are you?
I'm doing well. Thank you, and I'm delighted to join you today. Homeopathy has been a topic of great interest for years, and I'm excited to shed light on what the science says about it.
Homeopathy is often labeled as controversial. Can you explain what it is and why there's so much debate around it?
Of course. Homeopathy is a system of medicine developed in the late 18th century by Samuel Hahnemann. It operates on two core principles, like cures like, meaning that a substance causing symptoms in a healthy person can treat those symptoms in a sick person, and ultra-dilution, where substances are diluted to the point where only minute traces remain. Critics argue that these dilutions often render the remedies indistinguishable from water, raising questions about their efficacy.
That does sound questionable. Are there any scientific explanations for how homeopathy might work?
Well, that's where the debate deepens. Proponents suggest that homeopathy works through a mechanism known as the memory of water, where water retains a molecular imprint of the active ingredient. However, this hypothesis lacks robust scientific validation. What we do see, though, is anecdotal evidence and patient-reported outcomes suggesting benefits, often attributed to the placebo effect.
Speaking of placebo effects, some argue that this is the primary reason for any improvement seen in patients. Is there any evidence to suggest otherwise?
That's a valid concern, and the scientific community remains divided. Large-scale clinical trials comparing homeopathic remedies to placebos often fail to show significant differences. However, small, well-controlled studies in conditions like allergies and migraines have shown modest benefits, though they are far from conclusive.
So, given these findings, is homeopathy safe for patients?
Safety is one of the least contested aspects of homeopathy. Since remedies are highly diluted, adverse effects are rare. The real concern arises when patients rely solely on homeopathy for serious conditions, potentially delaying effective medical treatment.
That's a critical point. Can you provide an example where homeopathy was used successfully or controversially?
Certainly. A recent case involved a patient named Alice, who had persistent hay fever unresponsive to standard antihistamines. She tried a homeopathic remedy made from onion extracts, aligned with the like cures like principle. Within weeks, her symptoms improved. While it's tempting to attribute her recovery to the remedy, factors like reduced allergen exposure and the placebo effect cannot be ruled out.
What does the medical community recommend for patients considering homeopathy?
Many clinicians adopt a balanced approach. For minor conditions, homeopathy can be explored alongside conventional medicine, provided patients are well informed about its limitations. For serious illnesses, evidence-based treatments must remain the cornerstone of care.
That is the end of Part C. You now have 2 minutes to check your answers.